This year, Hartford HealthCare's Institute of Living is celebrating an exciting anniversary, 25 years of the Anxiety Disorder Center. The center is a game changer for those with anxiety-related disorders, providing the most advanced treatment options and research. Joining us live this morning to tell us more is Dr. David Tolan, Director of the Anxiety Disorder Center at Hartford Hospital's Institute of Living. Doctor, good morning.
Good morning. Thanks for having me.
Thanks for joining us. First of all, congratulations on 25 years. Quite the milestone. Very exciting, I'm sure.
Thank you. Very
Yes.
exciting.
Tell us more about the center and how essential it is for those with anxiety-related disorders.
Well, the Anxiety Disorders Center 25 years ago brought a unique evidence-based practice to the Institute of Living, meaning we use strategies that have been clearly demonstrated to be effective through scientific research. And in those 25 years, we've treated over 8,000 adults and kids from Connecticut who suffer from anxiety-related disorders such as obsessive-compulsive disorder, panic disorder, and phobias.
You answered my next question. You know, you hear a lot about anxiety, and I think it's a great thing that people are talking more openly about their struggles. And you mentioned the different types of anxiety disorders. So in your eyes, how has it really evolved over the years when it comes to treatment?
Well, through our research collaborations, we've increased our understanding of brain processes involved with anxiety. Now, what's interesting is that anxiety is in your brain, but that doesn't mean there's nothing you can do about it. And it doesn't even necessarily mean that you have to take medications for it. In fact, psychological treatments, such as those provided at the Anxiety Disorder Center, can have similar effects on the brain as medications.
Good to know, especially I'm sure for families who are bringing young children and they don't want the first resource or the first choice to maybe be medication. So it's nice that the team there is really working a number of different ways. What does this milestone mean to you guys and your team specifically? 25 years.
Well, it's very gratifying to be able to serve the population of Connecticut and to provide effective treatment. And I'm also very fortunate to work with an experienced and excellent team with a shared mission to provide evidence-based care and contribute to knowledge about treatment and about anxiety-related disorders.
Oh, that's wonderful. So what's next? What can we expect in the next 25 years, let's say, from the Anxiety Disorder Center?
Well, recently we've expanded our clinical and research inquiry beyond the anxiety-related disorders. And though anxiety remains our primary focus, we've done a considerable amount of work on the nature and treatment of hoarding, a very common mental disorder. We're also expanding our research into the domain of suicide prevention, and we recently completed the largest study to date of inpatient suicide prevention treatment using a collaboration with the inpatient units at the Institute of Living.
That is wonderful. Great work being done there. Thank you so much for your time and discussing all that's happening at the Anxiety Disorder Center with us here on Good Morning
Thank you very
Connecticut.
much.
And we will be right back.